So you're probably wondering why I have my thigh in a headlock. What I'm doing is a mobility enhancement drill known as a controlled articular rotation. This is just taking the knee through its full articular ranges of motion through internal and external rotation and working through the sagittal plane in flexion and extension while keeping those rotational components. So this piece of tape is placed on the bony prominence of the shin or the tibia, known as the tibial tuberosity. And you'll notice as that rotates over, the tape will follow along with it. So in, the tape will go in, and then turning out, the tape will go out. So you see the tape go in. The foot or the ankle is also traveling with it because we're locking the ankle down. And you'll notice if we kind of unlock the ankle, that tape's not going to go anywhere. It's just going to stay right where it is. It's going to stay put. You'll kind of see some of the calf or side of the leg, side of the shin musculature firing a little bit. And we'll try to lock the ankle down as much as possible and really try to figure out the rotation of the shin, of the tibia. So you'll also notice the femur can turn in and out, and this is also another component we want to try to lock down and get the tibia to rotate. So in order to do so, we will headlock the thigh and bring it as close to the chest as possible, lock it down, and really I want you to kind of play with it, really find the rotation first, get the fundamental joint motion, figure it out. It's going to take a little bit of work trying to mess around with this a little bit. Maybe put a piece of tape on that bony tubercle right there, and just see that ankle moving, and you'll see that shin is not going to rotate over if it's the ankle that's moving. So we can try to lock that down as much as possible as we take our knee through a controlled articular rotation. One way to kind of figure out how to get this rotation down is by placing the foot and setting it down on the ground. And here we're in internal rotation, so setting it inward and then bringing the leg outward. And then we can let go of that tension, turn it outward, and then bring the knee inward. So this is external rotation. So then again, to find that internal rotation, turn the foot in and then bring the knee out away from the body. And then let go of that tension, and then we're going to turn the ankle out, ankle and shin together, and then bring the knee inward, in towards the body. And external rotation here. Once you've figured out the rotational component, we're going to go ahead and go into extension and internal rotation, turn it into external rotation, and down into flexion. Keep it in an external, turn it in, and bring it into flexion again. And we're going to continue this process. And one component I'm missing is as we bring it down into flexion, we'll go ahead and turn it over at the bottom as well. So keeping it in one rotation. And then here the ankle is moving. Just to show you again, we want to turn it in and out of the shin with the ankle together. Bring it into extension, turn it in, bring it down. And here we can turn it into external rotation or keep it into internal rotation, whichever you prefer, whichever feels most comfortable for you. And just make sure we're keeping it, getting it into an extension as high as possible as we turn it over. And I know it's tough to turn it over at the top, especially into internal rotation. External rotation, bringing it out, it's going to be much easier. Turning it in is going to be much harder. If you have any difficulties, just let me know. I hope you enjoy it, and do this as much as possible throughout the day. Just keep it going. Keep that knee moving. Thanks for watching.